Testing's good.
Yeah, we did the check. Okay.
So you want to know about me?
Yes, please.
So basically, my name is Adam Davis. Part of Davis Pediatric Dentistry. Been practicing for about a little roughly over 10 years now in pediatrics. I went to residency at University of, I went to dental school at University of Tennessee. I did my residency at Bon Secours St. Mary's Hospital in Richmond, Virginia. Currently, right now, we have 4 practices in Tucson, Arizona, and we have 1 practice with the second one coming up in Maine. We see probably roughly between the offices down in Tucson, we probably see about over 3,000 patients probably a month or so. Maybe a little bit more, maybe a little bit less, depending on the time of year it is, I guess you'd say.
So except around Halloween?
Yeah. Not never during Halloween, man. Come on. Halloween, nobody wants to come in. They want to be eating all the candy.
See what's happening.
They want their candy.
Well, okay. So you do already have a 3D printer. I think.
Yes, we have a Sprint Ray 3D printer down at one of our other locations that we've been using for probably roughly over 2 years now. Me and my brother, who's also one of my partners, we've been using it for probably over 2 years, doing some printing of crowns and models of whatnot.
How has that helped your practice? What made you kind of delve into 3D printing?
Well, we started looking at 3D printing, in conjunction with, obviously, the company that we work with as well is AlphaBite. And we always came up with the problem of, we have an inventory of crowns that is a lot of them. Staff misuse them, sometimes they lose them. You go through multiple crowns try-ins when you're putting white crowns onto a patient. Sometimes the first crown doesn't fit, so you get a different crown. Then you have the duty of cleaning those crowns, getting them back into the inventory, and a lot of times, roughly what we guesstimate is probably over 50% of those products were either being dropped and broken or being misplaced, so you were losing your inventory without even using it. And so we had thought, what would be a better way to go about it? And it would be like, okay, if we can do what general dentists already do, which is create a crown, custom crown for that individual, then we could print that crown. We now have an infinite supply of crowns if we need them and when we need them. So instead of having all these crowns, we now can just fit specifically to one patient and have a crown for that patient. And we thought that would be a better route to take, and it would be lower cost to us over time.
Sounds great. And you've had Xylodent for how long now in the office?
I think it's roughly been 3 weeks,
Okay.
something like that.
How has that experience been going? How do you like it so far? What are some of your favorite features?
Besides this guy named Awesome, everything else was awesome. No, I would say it's been a pleasure. The unit now that we have here is concise. Sprint Ray is great. Like units like that, units that you have 3D printers, they usually have multiple systems. So it's like you're printing in one, you're taking out, you're putting it into the next unit with curing, or you're using alcohol first, and then you're going into a third. So a lot of times you have 2, 3, sometimes you can have up to 4 units that you're having. So you're taking up an expansive piece of real estate. And in pediatrics, we're concise. We want to keep it small spaces, keep most of the rooms full for patients. Rest of it needs to be in a smaller proximity. So with getting on the Xylodent, the product that we have here is now it's concise. It's very small, and the nicest aspect that I see out of it for right now, for me and for staff wise, is I scan a patient's mouth, we get a model made, we send the model right over to Xylodent, and it's able to just print it for us. Once we press print, we can leave. We don't have to worry about, okay, we got to get it out of there, we got to get it in the alcohol, we got to get the material off. We can leave it, it gets printed, the staff can come in, clean it off for those models, and then put it in and leave it, and we're fine. While before it's like, okay, is the print done? I need to go in and get the print. I need to do this. I need to make sure that something is done. While Xylo is all in one, that you're able to flow in, and the footprint is so much smaller.
Great. Okay. What can you talk about a little about the Xylo Prep software?
Oh, the Xylo Prep software, yeah. The Xylo Prep software came in, there's other softwares that are out there, every company has their own software with 3D. Some are cloud-based, some are on the computer, like Xylo Prep is on the computer, which is nice because you're able to have your files from wherever you're scanning it in, and portability is really nice. Like you can port in really easy into Apply files, get those files in there. I mean, I feel like it's a lot simpler to use than some of the other apparatus, because it's basically, you can control print, control copy, making multiples on one system. The other thing that's really nice about it is like you can arrange them. Like it's really intuitive in a lot of the aspects of like how many supports you need, can you take away supports, what supports shouldn't you be taking away. Some of the other ones you look at it and be like, okay, I'm gonna take this support away, and you're taking it away, and then all of a sudden you print it and it's failing. While this one's like, hey, you need these certain supports, you can remove these other ones, but this is what we believe is the correct amount, which is nice to see.
That's great. And most of your printing is usually revolving on crowns, and I'd like to know how the AI crown print feature has been helping with that.
Oh, the AI crown feature, the nice aspect of that is when we get our sizes of our crowns and we're able to put that file into the Xyla Prep and you're putting it all the way through, it's basically done. I mean, it pops right in, it rotates it right to the right surface, puts a base on it. You literally are ready to print. There's no need to do anything else unless you're trying to conserve a little bit and you want to do less supports here and there. But for the most part, it's done. Once it gets into Xyla Prep, it's ready to go and ready to be sent over to print.
Can you tell us a little bit more about AlphaBite? What made you guys come up with it? How does it help you in your work?
Kind of like we were talking about before, is AlphaBite came about kind of from my brother Charles, and his partner in the company is Andrew Johnson. Is what happened was he came out one time and we were doing a lecture and he was telling us, he's like, oh, like the future of dentistry is like in 3D printing, and we're like, oh, that's great, sounds awesome. For pediatrics, we don't do that. We have a cut, run, and mill. I mean, since the age of time, pediatrics has known silver crowns are the standard of care. We know how to do them. We can do them fast, so we can get them in. Then along came white crowns, and it's like, okay, if you want to do white crowns, you just have to prep a little bit more. It's the same thing, plug and play. Can you put a crown on? Can you do this? Well, when we were talking, and then they started talking a little bit more, and they're like, we could get into this space and start doing crowns better. Why shouldn't everybody have the ability to do white crowns? Most pediatric dentists, I mean, same with me at the start, was like, you're cutting up a crown, I know how to do a silver crown really well. I can do it really fast. I know that how fast it's going to take me. Well, white crowns were the rate limiting step, because it's like, oh my gosh, I have to prep more. The kid's not doing well, I'm going to have to jump to doing a silver crown. I told mom we could do a white crown. All these different facets come into play. So with AlphaBite, it kind of came about from that. It's like, can we get scanning into this, something that's almost every general dentist uses on a regular basis? Can we get this in there? Like, yeah, we got that in there. And then it was like, can we build upon that foundation to get into pediatric crowns that are custom made for the pediatric patient? Can we get a crown that's made to them? You don't have to do as much prep as you're having to do in the past. You're having to do minimal prep. Crown still looks good, still functions well, and you're able to get a quality product to the patient and out the door in a timely manner for that patient to still want to come back.
Perfect. And this is a little bit of a look into a future kind of thing, but how do you believe AlphaBite will integrate into 3D printing in a seamless manner? What is your kind of outlook into?
I mean, the outlook for us is the awesome nature is pediatrics is fast. You need to be in there. I feel like you've seen it now with a lot of with the kids that are here. It's like, you have some kids that just can't tolerate a long time. I mean, patients in general dentist practices, you're sitting there and you're like, okay, we're gonna scan you, we're gonna develop the crown, we're gonna print the crown, we'll be done in an hour, just hang out here, we'll be back. Kids, it's like, hey mom, we're gonna be back in an hour. Parents are like, listen, I gotta get back to work. Listen, he's gotta get back to school. We're not staying. We're leaving. So that's why crowns are already done, So what we see for the future is like getting with the Xyla Prep and Xyla Dent, and you can use those the aspects, and you can cut your time down to printing these crowns down. Then we could do a custom crown for the patient in the chair, same day. They're in that morning, they're done by that treatment in that 30-minute window. You're going in, you're scanning the tooth, you're numbing them up, you're walking out, you're walking back in, you're placing the crown on, and they're leaving a happy camper. That's the big aspect. Is I always say is for pediatrics wise, it's you're sitting there and you have a tooth that you're doing a filling on. Well, the parent didn't come back for 2 months. Okay, well, great. Well, hopefully it's still a filling. Well, then you go in, you sit down, you're like, needs to be a white crown now. Well, right now, printing as it is like, okay, we can do a white crown, but we got to do these generic ones. Well, now we have the ability to scan it, clean it, 3D print it, have it ready to go in the mouth that same visit. Now the parent's way happier because now they get a custom crown to the patient, exactly what we want. There's no, like, even if there's space loss or anything, the crown is made directly for them.
Perfect. A couple final questions. In your opinion, what are some features that you think would improve the Xylodent experience, the Xylo workflow in general?
I mean, I think the workflow is pretty well. I think like from the scan to getting in the Xylo prep to figuring it out to getting it into the unit is pretty good. The one aspect, and we've talked about this before, is kind of like it would be nice if I'm doing a crown and I'm doing multiple crowns. Say that I have a big case, and we were talking about general anesthesia cases where you're doing a lot of crowns at one time, and I would like to be able to print all those crowns off, but to be able to know specifically which crown is which one. Because a lot of the anterior teeth, they look the same. A lot of the posterior teeth, as you know, look the same when you're printing them out. So it'd be nice to have a feature where, whether it's on the base or somewhere, that it says, this is B, this is C, this is this is this, so that it's not like, okay, I can tell it because I know which crown looks like which, and I don't have to put it in a certain place on the pad. It's right there. I can do a bunch of crowns, but I know exactly which one the crowns are.
Perfect. And we had a fun little experience here, a fun little experimentation with the printer. We've been trying out some toy prints.
Yeah.
Yeah.
Yeah, some great prints, man. I mean, I gotta thank Awesome for finding these ones, but I mean, you gotta be kidding me. Like we were just a little bit on edge that these wouldn't roll and wouldn't walk, but the wheels roll. Like, I mean, it's a fire truck. Like, that is the coolest thing. Like, you get a fire truck. We had an excavator which moves, and my kids were like in awe of this thing because it's able to move all the way around from the 3D printer. Rolls. I mean, they're amazing. Tried to do some other ones, some airplanes. They didn't work out as well, but we got some cool ones that came out like that. Pretty sweet. I mean, pretty cool to be able to print out these, and like if kids doing really well and you have time to print them off, they print out pretty fast, and be able to hand them out as little toys, little trinkets. It's never a bad thing.
Thank you so much, Dr. Adam. This was a pleasure.
Yeah, it's been good. It's been fun having you guys out here and be able to use this and test this out, because it's been an amazing time.
Perfect. That's great. All right.